Welcome, friends and warriors, to another episode of Power Over Pink. I am your host and breast cancer survivor, Tara Cam. On my channel, I highlight other survivor stories to have them have a voice in the system and help others know how to navigate their own battles and give hope and encouragement and inspiration that you have power over pink too. So welcome to the channel today, my good friend, now Natasha Parker. I say good
Hello.
friend. I just think that you're wonderful and I really connected with you when we met. So I'm so happy to have you here to tell us your full story.
Yeah, I'm happy to have met you. It was exciting to see your cute little station at the conference, the YSC conference this year, and get to meet you in person. And I'm just excited to share my story.
Well, I know that you've got a good story. I've heard just a snippet. So those of you who don't follow me on Facebook actually have a shorter interview of her on site at the summit. So check that out for sure. But I know that there's so many more layers to everyone's story. So that's why I wanted to hear your whole story. So first, tell us a little bit about you and where you're at, what you do, all those things.
Yeah. So again, my name's Natasha. I am currently 39. I turned 40, the big 40 this year.
Ooh,
Excited about that. So definitely gives you a different perspective on age.
right?
Prior to cancer, it's like, oh, I'm getting older. Now I'm like, yes, I made it to the next,
I get to be
milestone.
older.
Yes, yeah. So super excited about that. I am a nurse professionally. I've been an RN since 2008. I've worked in a number of different settings. I started out on med surg, and then I did like a women's health unit where we did some like postpartum and antepartum. And then I transferred to the neonatal intensive care unit where I took care of infants, pretty sick kiddos. And so I did that for several years in an inner city hospital. They came with a lot of challenges demographically, and then also physically. So after that, I had met my husband, my first husband,
Mhm.
and we got married and relocated for his job. And so when we relocated, I started teaching nursing. And so I went into education and taught nursing for 5 years at a practical nursing program. And then we had our two children at that point, and I kind of was like, all right, we need to get back closer to family. So we ended up in the middle of the state at that point in Missouri and the Columbia, Missouri area. And when I got to Columbia, I started at the local hospital here that it's educational medical training center. So they're pretty well known for education and research. And so I started working in orthopedics, but then quickly went back into education training staff. And so I did that for several years. And then I took on the position as magnet coordinator, which is a designation that nursing strives to achieve to be in like the top 10% of the hospitals nationwide, actually internationally. And so those are big shoes to fill. And I did that until I got my cancer diagnosis. And actually, I worked the first 6 months of my IV chemo phase. So I'll kind of backtrack. I was diagnosed in December of 2022. Initially, it was stage 2B triple negative breast cancer. I was 37 at the age, so I found it on my own. I had been told throughout my early 20s and 30s that I had very dense breasts with lots of fibrocystic changes. And so I just really had to get to know my body to do those monthly self exams. And I knew that they would always change with my menstrual cycles. So I just monitored them very closely. I don't have any genetics. When I got my diagnosis, they did the full genetic testing. All of that was negative. But I do have a family history where my grandma was diagnosed and she was in her 60s at diagnosis, and she battled it the first time and then it had a recurrence. And then the second time when it came back, it was like inflammatory and throughout her body. And so unfortunately, she passed away from breast cancer. But because of that reason, her two daughters decided to do prophylactic mastectomies. And one of the two ended up she tested positive from the pathology from her prophylactic mastectomy. So thankfully, it was early stage.
Yeah.
Surgery took care of it, and that's all she needed. So while I say I have no genetics, I have a lot of family history with breast cancer. And so I just knew that I had to be very observant with my body. I did what I thought would prevent it. I breastfed both of my children. I tried to have a healthy lifestyle, avoid, as much toxins as possible. I was never a smoker. I had an occasional beverage here and there. My early 20s was, I was in college, but for the most part, I had a very active, healthy lifestyle. So I thought I was doing all the things. And then at 37, I noticed this area of hardness in my breast that was different than the cystic, fibroid cystic tissue. And so this was like a wedge, almost like a rectangular wedge at the top of my breast. And I was like, well, that's kind of different. Usually they're kind of circular but this is different. And then I monitored through 3 of my menstrual cycles. And so usually the fibroids would get less after my menstrual cycle. They would change in density, they would get less tender, softer. And then through the weeks leading up to it, they would get more firm and tender and things. But this was solid. There was no changes whatsoever. And so again, I was like, that's different. And then I started kind of having this nervy, zappy pain coming from the breast, kind of down the arm a little bit. And again, I was like, something's different. Yeah. So I was scheduled anyways for my annual women's health exam. And so when I was in there, I let her know, this is something I noticed. She palpated and she goes, you know what? You're close enough to 40. We're going to go ahead and do your first mammogram. Lo and behold, that's, when we found it. So I went in the day of the mammogram. I knew that with dense breasts that usually they do the mammogram and then they follow with an ultrasound. So none of that was alarming. Did the mammogram. They sat me in the women's waiting room. They have this cute little thing, this side note, but every year the hospital puts on this bra fundraiser where different groups will get together and decorate bras and have different themes behind them. And so they'll display them in the imaging area. And so there's one of this older lady, and it talks about how our boobs have served us throughout life. When we're young, they're perky, they're part of our identity. And then when we have children, they feed our young. They're the supplying of nourishment to our children. And then, when you get older, they're down to your belly button. And now they're just there. It was just really cute in that poem, and maybe I could give that to you as a sign. I don't have it memorized, but it was really cute in the picture too. But just talking about how it is part of who we are, and they serve us, and then you get this diagnosis, and it's just life altering. And so it provided a little light in kind of the turmoil of everything. But anyway, so then I went in for the ultrasound. The ultrasound tech was doing the scanning, and we were just having a casual conversation. And in the conversation, she just kind of pauses and left me hanging, And so I was like, something seems off. And that's when my red flags went off. And I was like, okay, she sees something. And she goes, do you mind if I step out? I'm going to go get the radiologist. I'm going to have them come in and take a look. And so as soon as she stepped out, I knew it in my gut that she was seeing something. And so he comes in and he starts scanning, and he asks the question, how long has this been here? And I'm like, this is not a good sign. And so I said, I knew I'd felt it about 3 months ago. And he said, I am concerned about this. I really want to get a biopsy. I would actually do it today, but I just don't have time in the schedule. So I want you to, and this was a Wednesday. He goes, I want you to come back Friday and we're going to biopsy this. And then they had me step out to talk with the scheduling lady. And then at that point, I just kind of started crying because I just knew. And she's like, don't be alarmed. 80% of these are negative. Was trying to coach me through it. The other weird kind of circumstance was that this was where I worked, and I knew a lot of people because of my position. And I had, this imaging area is quite a far distance from the parking garage. So you have to walk through lots of hallways and corridors. And so after leaving that appointment, I was like, get it together, get it together. Like you just have to get to your car. If you can make it to your car, it'll be fine. Like just get to your car. And so I just kind of was like hoping and praying I didn't see anybody because I knew whoever would come in my path, I would just lose it.
Yeah.
There was no holding back. And so I was like laser focused, get to the car, made it out to my car, and then the floodgates were like full on. Had lots of like, oh my goodness, it was almost Christmas. We're talking early, mid-December. It was around December 12th. And I was just thinking, like, is this my kid's concert was coming up? Like, is this going to be my kiddo's last concert that I get to go to? Is this going to be my last Christmas with them? Just all those like big existential questions that we don't really think we're going to be faced with at 37. That
Right.
now here I am. I immediately called. My husband was working, so I go to voicemail and was just like, "You need to call me back." And then I called my mom. Told her she's down in Florida, and I said, "Mom, it didn't seem good." And she's like, "Okay." And so she had to get off the phone. I think she needed to like digest it herself. And then she called me right back, and she goes, "I'm booking a flight, and I'm going to be there when you get those results. So regardless of what they are." And so she booked her flight and came up within 3 days. She was there by the weekend. So
Wow.
I'm super grateful for that. So I did go back Friday, try to just keep in like mind of I still had work to do. We were actually volunteering as a group, our department. And so that was kind of a good distraction. Got through the biopsy. I ended up taking the rest of the day off because that was an interesting experience. I don't know if you want me to share that. But
Yes, please do. Was it stereotactic?
so, yeah. So, what happened initially, so of course, it's a training hospital. So, the resident gets the opportunity to try it out first.
Mm.
The ultrasound tech was scanning. He was going for it. And initially, it was not the spring loaded, but I think it's the stereotactic where you press the button and it kind of does like a drilling noise sort of thing. So yeah, he located it, attempted to get it. It wouldn't, it was so dense and firm that it wouldn't like puncture through it. So he pulled it out, did it again from another angle, tried again, no luck. I want to say he did it 2 or 3 times. And then he got the main radiologist to come in, and the main radiologist was like, "Okay, we're going to have to use this old version of the spring loaded." And
Oh,
I'm like, "Oh, great." So they get that all ready. And then, of course, the resident still gets to try. Didn't have luck with it. And then the radiologist does it and was able to finally get the sample. It was not
painful.
comfortable and pretty traumatic. So
So was it 3 attempts or 4?
it ended up being 4 before they finally got the sample.
Oh my gosh.
So yeah, I definitely took the rest of the day off and took lots of Motrin
Yeah.
to manage the pain. We had some decent bruising after that.
Think
But
just to touch on
yeah,
that for like a second,
yeah,
like, I had many biopsies. The first time I had like the precancer scare. So the second time I was like, no biopsies, just cut it out. Like I already know that I want it out. Like we're not going to do that because nobody really ever talks about how, painful the biopsies are. Like you hear people get biopsies all the time and you're like, oh, okay, no big deal. They're just going to take a little sample, but they can actually be quite uncomfortable and leave you
yeah,
swollen and hurting. And I wasn't quite prepared for how uncomfortable they work. So
yeah, yeah.
it's a
I
real
wasn't either. I
deal.
thought, oh, no big deal. They numb it, and they
Uh-huh.
did numb it, which that alone is, you get a needle to the
Yeah,
breast,
not fun.
which is already tender, So, it's definitely not comfortable, but yeah. Yeah, so I had that, and then the results started coming in on the Monday after. And so I had access to the portal, and being a nurse, I knew where to look, and I was not going to wait to look at my results. So I pulled them up on my computer, and it did say that they were ready. And so as I pulled it up, I saw the word carcinoma, and
Mm.
I just felt it in my gut, like my heart sank. I didn't my mom was here, but I didn't even say anything to her because I just needed like a few minutes to just process the reality of it all. It's one thing to like suspect, it's another thing to get the actual answer. And so yeah, I would say I was in like full fight or flight mode at that point. The adrenaline was rushing and then just started crying. And I went over and told my mom, I said, it's cancer. And we both definitely had some moments of crying and just feeling through it. But then also, like, what does this mean?
Yeah.
Like, what's next? What does
Right.
this mean? And so those answers weren't there yet. It didn't say the type. There was still a lot of the results were pending. It did say carcinoma. It's IVC, interductal carcinoma. So I knew location and I knew carcinoma, but I didn't know hormone status. I didn't know HER2 status. So all that was still to be determined. And actually, I got the call just a couple days later from the resident to give me the information that I had cancer. And that was kind of interesting too, because the lady who did the scheduling originally called and said, hey, I have a resident here who would like to give you your results. And I already knew. And so I was like, okay, I know residents have to train and get this experience. And his approach when he got on the phone was, yeah, so your results came back and you do have cancer. And then it was like dead silence. I'm like,
Wow.
okay.
Need to work on your grace there, sir.
Yeah. Okay. So what's next?
Wow.
And he's like, well, you'll get a call from the medical oncology team and the surgical oncology team. They'll call you to get some appointments set up. And I'm like, okay. Do we know anything else? And he's like, no, but you have cancer. And I was like, all right. So I don't know. I mean, I really hope that this instance was like a training moment to where maybe somebody coached him after and was like,
What
okay,
not to
here's how
do.
to have, yeah, let's have a little more empathy in this moment. You're telling somebody like the biggest news ever. Thankfully, I knew I was pre warned by checking myself, and I'm glad I did now because that would have been like
A huge
even more
blow.
devastating. Yeah.
Yeah. But at least it was on
Um,
the phone. Like, I do appreciate that because I was in
yeah.
office and I went by
Yeah.
myself and big mistake.
That's hard. Yeah.
I was
Yeah.
like, "Why couldn't they have called me and told me over the phone so I could fall
Told
apart in
you.
my house instead of having to drive
Exactly.
home after?" But so I can
Yeah.
appreciate at least, even though it was not tactful at all,
Yeah.
that you were
Yeah.
able to fall apart at home.
It is interesting. Yeah, I feel like that is kind of a standard. I've heard that a lot where they'll call people into the office. And I feel like that would be a clue for most. Like,
Mhm.
okay, you're calling me in. Why not just tell me now? Like that delay time of not knowing, but knowing.
Well, mine was because I had
Such
the
a weird.
surgery, I bypassed the biopsy, so we did the lumpectomy,
Gotcha.
so I was going to get my results from surgery, so it was with my surgeon,
Okay.
and I think
Okay.
that's what really messed me up. So
Yeah.
don't do
That
that.
would be hard. Yeah. Yeah.
And I was like, "Well, they would have called me if they found something."
Yeah.
Like, I told my husband,
So
I was like, "Don't go, it's fine, they would have called
it'll
me
be
if it was
good.
cancer."
Yeah.
But anyway, go ahead.
Yeah. No, our support system is huge. I definitely like the fact that my mom was able to be in the house because everybody else was at school and work, and to have her presence like immediately there with me was huge. So I can't imagine getting results like that and just being on your own and having to process it all.
I wish we could do something about that delivery system, in the medical professional world. It's just another day to them, but it's our whole world. So it's like they
Yeah,
forget how impactful that word is and how scary and, how it just you have so many uncertainties and thoughts, but then you can't comprehend anything at that point because you hear the word cancer. So I wish they would do something to deliver that better.
I agree. Yeah. And I think so being a nurse, that is the perspective that I've taken from all of this is now, I mean, the empathy is going to be huge.
Yeah.
Just the fact that when you live it and you realize how your entire world is just flipped upside down in a moment,
Yeah.
like that kind of news. I mean, you know, it's a big deal and you know that it's hard and you do try to, like thinking of my past self, you try to be cognizant of that and be supportive and offer that support, but there could be more things that you could do. Like you could make sure that they have a loved one with them. Like, do you want to call your mom or dad, or do you want to call your family member, whomever, your spouse? Like you could set the stage better and make sure they're in an environment where they feel like they've got some sense of security and safety. And yeah, I agree. Definitely some areas for improvement.
Yes.
Yeah,
But I imagine it does make you much more empathetic with your patients now, so
yeah,
soon to be.
yeah, yeah, yeah. So yeah, I got the diagnosis. Unfortunately, it was like Christmas time, and so we had to wait through Christmas because everybody's schedule is really tight around that time. So I couldn't even see the first doctor until January. So
Mhm.
I had a few weeks of knowing I had cancer, not really knowing what was next. And so I didn't tell the kids initially. That wasn't my plan until I had seen the doctor because one of my kiddos is very intuitive and very, like wants to know details. And I knew that if I knew but didn't have those details, he would go to the worst case scenario. And so he's kind of like me.
Yeah. Sounds like me.
Yeah. He gets it from me. I'm the problem. But yeah, so I was hopefully avoiding it. However, we have the best intentions and plans, and then life happens. So, one of the days that I had just picked up so I have two biologically, my husband has two. So, we have four combined. And so they're 13, 12, 11, and 8, but they were 2 years younger then. So, you do the math. Anyhow, I had them all in the car. We were driving home from school, and I get a call from the hospital. And I'm like, I need to answer this because I need this information. It was the end of the day. I knew if I didn't have it, I would have to wait till the next business day. So I'm answering it in the car as I'm driving, and I'm trying to keep it very like nonchalant, like, And I think it just hit me like the reality that this is where we are now. My life is revolving around appointments and who I need to see and lab work that I need to have done and all this stuff. And so again, I started crying and trying to keep it together. And I make it to our subdivision, and my daughter actually starts getting motion sick in the car, which happens for her.
Mm.
And so I get off the phone, I'm crying. My kid's like, "Why are you crying?" And my daughter starts vomiting.
No.
And it was just like everything hit the fan, and I was just like a mess. I pull in the driveway. My husband was at home already, and I told the older kids, like, go inside, go get David, have him come get my daughters because she just threw up and she needs help. And I'm like a mess. And my son stuck around. He's like, "Mom, why are you crying?" Like, adult throws up. It's not that big of a deal. And I'm like, well, yeah. He's like, well, what was the call about? So I told him, I said, I need to tell you something. And he's like, what is it? And I said, well, I have cancer. It's breast cancer, but I don't know at this point, like, what that means. I know I'll do treatment. I don't know how advanced it is. And so, of course, he starts crying and gets pretty emotional. I'm like, I know, buddy, I know this is really hard for you. I don't know all the answers right now, but what I do know is like, I'm going to give this my everything. I'm going to fight with everything I have in me. And that was the only bit of reassurance I could give him in this area of so much uncertainty and unknown. What else can you say? You don't know,
Right,
you
you
know?
don't know.
And I know his experience with cancer. He doesn't have a lot, but he's had family friends that have had it. And so unfortunately, people have passed away from cancer. And so I know his mind was there. He was scared. And so we had our moment, came inside, and then I did let my daughter know, but she was just at the age where she was just like, okay, I don't really know what that means, and move on to the next thing. So it's kind of a blessing for her that she like didn't really get it. And then the next few weeks, we were just in that wait phase. I did have an MRI, which then told me that it was at least a stage 2 based on size. And then they had this unidentified area that popped up. So they didn't know for sure exactly how big it was, but we knew it was at the minimum like 3 centimeters. So it was a decent sized tumor. Because of that, my husband and I just, well, I guess I could say I decided. I said, it's Christmas break, and with our blended family dynamics, we do end up, because we get them for like a week over Christmas, and then we kind of get a week off without the kids. And so I was like, we're going on vacation. I don't know when we're going to travel next, and I need to go.
Yeah,
Yeah.
that's a good idea.
So we quickly booked a trip down to Mexico to be on the beach. That's a whole funny story in and of itself because we booked it urgently. I didn't do like the insurance because I was just dead set, this is happening. Nothing's going to keep us from going, to pull out our passports to find out they were expired.
No.
So then we were like, oh, shoot, now what? So I start calling like the passport security office, trying to figure out if there's any way we can expedite it. And they're like, well, it's got to be kind of a dire situation. I'm like, well, I do have cancer. I mean, and they accepted that on the phone. Closest location within that time span, because we had like 3 days to get it, was down in El Paso, Texas. So we literally hopped in the car and drove, and I can't remember how many hours it
I
is
mean,
from
that's
here, but
far.
it's
Yeah.
like 16 maybe. Hopped in the car, drove overnight down to El Paso, Texas to get there just in time for the office to open. We got there, and we're not the only ones who are like last minute passport people. There's all these people like in the room talking about why they're getting it. And I hear these people, they're like, oh, it's just expired. I just decided I needed to get it because we're taking this trip. So here I'm thinking I got to have this like big souped up, like, I had cancer and they don't even ask you when you get there on why. They're just like, you made it to the appointment. Here, pay the
Wow.
fee. We're going to get this processed. It took a few hours. We got our passports, and then we made it back to Kansas City, which was where we're flying out of. I think it was maybe 3 hours before our flight. So
Wow.
I had some points through Hilton. I booked us a room so we could shower. We didn't even go to sleep. We just showered and then went to the airport and flew to Mexico.
Now that's an adventure.
So yeah. Whenever we do stuff, we always have excitement, which is
Go big or go
funny
home.
exactly. It's funny to look back at, but my in-laws were like, you guys are crazy. And we're like, we know, but it's
Yeah, but I fully support the idea of taking a trip and
okay.
just
Yeah,
getting your mind right and having some fun before it starts.
exactly. Especially since, you're like, I just knew my immune status was going to get tanked. I knew like I wasn't going to be traveling for a good probably 9 months at the minimum. And dependent on everything else, you just don't know what's going
Yeah.
to happen.
Yeah.
So you know how they say it's called like a baby moon before you have the baby? I called it my cancer moon before I
Yeah.
went through cancer treatment. So I highly recommend if anybody can make
Check
it
your
happen.
passports first.
Yes, check those first if you're going out of the country or get the insurance.
Yeah.
Yeah. So we came back, and then, the kids are all back to school. And then I started my appointments. And within the next week, I was doing chemo, had my port placed, started IV chemo. I was terrified. We had great nurses, though. I remember the first day they had me in a private room, which was pretty nice because I guess the first time you get it, you could have like, if you're,
Big
you could
reaction.
have more severe. Yeah. So, Julie was my nurse, and we got to know each other very well. And usually we still keep in touch. We're about the same age, and we have kids about the same age, and we go to the same church. It's just a blessing that like God aligns these things sometimes that when you don't even recognize until after. Julie was my lifesaver that day. She's an ICU nurse previously, so I knew that if anything was going to go wrong, like she's got this.
Yeah.
And so she was the sweetest. She had like this little gift basket when I came and made sure I was completely comfortable the whole time through. And then as it was infusing, stayed in the room, of course, for quite some time, just making sure everything was okay. My husband likes to say that I was like comfortable in the bed, but as soon as they started, I was like withdrawing into the back of the bed. I was so terrified.
Yeah.
And I mean, I can remember feeling like I have no control here. Like, this is it. Like, I have to take this technically poison into my body, and I have I don't have any control. I have to do this. And it was terrifying. Thankfully, no reactions. I actually didn't feel so terrible that day because of the steroids. And then was like awake and alert and buzzing around for those first 48 hours until Saturday hit. And then that's when I like hit the wall and was just chemo brain and just tanked.
Yeah.
No energy. I didn't have a lot of nausea, thankfully. The medicines that they had prescribed were pretty helpful, at least initially. And then throughout it, it got a little more worse each time. And I did start to have some more intense nausea that they added in a medicine pre-op or pre-treatment, which was really helpful. So I just always like to tell people that are going through it, like, if you have any side effects, please speak up, like say something, because there are other options. Don't
Yeah.
think that what they've given you is the only thing. There are ways to make it easier. So, and then after probably like 6 or 7 rounds, I would go in every Monday. I'd get it on Thursday, go in Monday and get an extra bolus of fluids just to keep me hydrated.
Good
And
advice.
that helped. Yeah, that was really helpful. But yeah, just always speak up about any side effects, even if it's just like subtle things. Just definitely bring it to their attention, and let them know, because there are ways to make it easier.
Yes. And
Yeah.
something may start subtle and progressively get
Yes.
worse.
More intense. Yeah. Yeah. And so, yeah, I did the Taxol Carbo. Around the ninth one, though, I did talk them into reducing my steroid dosage because I didn't like that feeling of being like so buzzy and like
Yeah.
busy. I knew I needed rest and I wasn't getting it, and it would cause more anxiety. And so they did reduce it. But then by the ninth round on the carbo, I had a response to the carboplatin. And so I got a big bolus of steroids and then ended up with a regular dose of steroids for the last few sessions. You know, advocating is good, but also be prepared that sometimes you have to pivot and make changes. Yeah, it is
And
what it
trust
is.
that they know what's best.
Yes, yeah, exactly. And then so once I finished that, then I went into the Red Devil for 4 rounds. I definitely lost all my hair. When I was doing the AC, which is the Red Devil, I don't really like that term, but that's
I
just
hate
what
that term. Yeah.
I know. Yeah. So I've heard other like blood of Jesus,
Mhm.
or I've heard Jolly Rancher, like watermelon jelly. I don't know.
Yeah. Let's make it positive. I don't want to think
Yeah,
about a
I'm not
devil
so
going through my
scary.
body.
Yeah, exactly,
I didn't
exactly.
have to do it, but I've met many that have had to. So
Yeah. And that one, I did start having some like heart complications. My magnesium and potassium tanked. And so I ended up in the ER at one point where I had to get boluses of those to get my heart to stop having palpitations and more fluids. Definitely felt drained. I mean, there was a point where I was like, my head was against the window in the car and I felt like I just couldn't lift it off of the car. Um, so it can be very fatiguing and exhausting. And
yeah.
but again, if you have any symptom side effects, speak up and ask
Yeah.
for support.
And listen to your
So
body.
listen to your body for sure. Um, and then made it through all of the 16 rounds, also doing immunotherapy throughout. I did Ketruda. And then I rang the bell, which I always find is a kind of ironic time because I was blessed by having a lot of family there to celebrate with me, family and
Mm.
friends. But it was funny because it's like, well, what do we do after? Usually after celebration, you like go out and have fun, right?
Yeah.
But after chemo ring the bell, you're like, I need to go home and go to sleep. I just finished 16 rounds of chemo. So
Right.
they were gracious in knowing like, okay, this is what she's doing. And actually my friend who drove up from Oklahoma and my husband took the kids out to go bowling and do some fun stuff, which gave me time to rest and
Yeah. That's
sleep it
nice.
off. So, and then after that, I had to give it at least 6 weeks for my immune system to bounce back. And then I went in for my double mastectomy. I decided to do a double with the family history. I just did not want to have to go through this again if at all possible. So I had both removed, but I knew that there was a high chance that because they had done an ultrasound between the Taxol Carbo and the AC chemo, and they still saw a little bit. It had shrunk, but they still saw some. So I knew that there was a good chance I would end up doing radiation after. So I had expanders placed. And then the pathology came back, which did show that I still had active cancer in the tumor bed, and then a micromet in one of the, I think it was 6 lymph nodes they took. So after recovering from the surgery, I had about 4 to 6 weeks of recovery there, and then started radiation
Mhm.
and then did 25 rounds of that, which between the two, the chemo and the radiation was easier just because it's a faster, like I can do hard things in a fast amount of time, but the chemo is so drawn out that to me it was harder. I did have considerable skin breakdown, and I did like towards the end definitely have my moments of like, oh, this is terrible, this hurts. But and then of course after you finish radiation, what I was told was it like it's burning kind of from the inside out. So the few weeks after, it's going to continue to do that process, and then a few weeks later it started to do its healing thing. And so did the radiation, and then I still had to do 6 months of the oral chemo, just to what they call mop up chemo in case there's any rogue cells somewhere in my body, and then finished out the Ketruda. So I did 17 rounds of IV Ketruda. So it ended up being about a 2-year process, because then after that, I had to do a little recovery time, and then I had my reconstruction, and I chose to do the deep reconstruction.
Okay.
My goal is to use my own tissue and not have any foreign substances. But what we thought was like abdominal fat that I could use, it actually was, I had that, I think it's called a diastasis recti, where your abdominal muscles
Yeah.
are pulled apart from
Yeah.
my having children. And so it was almost like that, what my little pouch was like a herniation versus fat.
Darn.
So, I mean, it was kind of good news to get, because I was like, well, cool, this
Oh,
is
cool. I'm not
validating.
fat, but
Yeah. Not the mommy weight that I retained. It's just the fact that I have no core. And so she goes, your abdominal muscles were like in 2 different zip codes. They were that far away.
wow.
And so I was like, okay. And so she goes, I repaired that for you, brought them back together. She had to do a double line suture internally. You can't see it. And then I do have a suture line from hip to hip from where they took that, and a new created belly button, which is kind of weird. So she did place that, but since it wasn't enough tissue to provide projection, she said they would have been concaved if she didn't have implants. And so I did kind of know like there was a chance. I told her if we have to go the implant route, that's fine. And so I do have implants, but I also have the flaps, which is different.
Does it make it look more natural to have both, maybe?
Yeah, I think so. I mean, if you look without anything on,
Mm-hmm.
no, I mean, you can tell there's been surgery, but if under clothes, like you can't tell the difference. People can't
Right.
tell. And so I do like that. Like you can't tell that I've had cancer. Don't know yet as far as like nipples, what I'm going to do, if I'll do tattooing of those or if I'll do some sort of floral. I've seen some really cool ones out there.
Yeah.
I'm just still like, I don't know yet if I even want to or need to, because there's zero sensation in that area to me. So it's just, I
Yeah.
don't know. I haven't decided. And I am numb where my abdominal incision is down there too, plus down the center where she did the bringing of my abdominal muscles together. But I do have a very flat tummy now. So,
Hey, that's a plus.
you win some, you
If anything good came out of this journey, that's a good
yes,
thing.
yes. And it's reduced my lower back pain because I actually have a core now. So that's kind of cool too.
This is cool. Yeah.
Yeah. I feel like I'm definitely stable, like more in place than I was previously. So yeah, went through all of that and then had my phase 2 reconstruction in October of 24. And so now I'm clear of all treatments. I've been off all active forms of treatment since April of last year, and I finished all my surgeries. At least for right now, I don't think I'll do it. She said that there could be like a small touch up if I wanted, but I'm just at that point where I'm like, I'm content. I'm
Yeah.
happy.
I think I'm done.
Go back. Yeah. So yeah, I'm at this phase where I'm getting back to work and
Yeah.
getting back to reality, I guess you could say, again. So it's exciting, a little nerve wracking, just having to go back to a full time workload and managing 4 kids. And I've been very accessible for my family over these
Yeah.
several months, which has been a blessing in it because I have been more available than I would have been. So I'm kind of like having to slowly pull back the reins on that and be like, nope, I can't just run to school for you today. Like,
Yeah. Yeah.
you're gonna have to figure it out. So, which is a good lesson too for them. So,
Yeah.
yeah.
Well, I mean, I think that it's important to talk about the longevity of the treatment time frame.
Mm,
So you said it was just over 2 years of
yeah,
everything, and that's reality because I think all of us are like, oh, well, I have cancer, let's just take care of it, and you don't really fully understand that it could be, no less than a year with
yes,
all the things and the stages and the, treatments and the weight and the blah, 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 blah. There's so many layers to it. So I think that you fully need to mentally prepare yourself for, maybe it's 6 months for you if it got found early, but maybe it's 2 years or 3 years or a lifetime if you're
sure.
stage 4. And so
Yeah.
that's good that you mentioned that time frame. And also, what a blessing to have that 2 years with your kids, though, because that's a whirlwind for them to go through as well. So I think that it probably is so crucial to have that time with them and then them kind of see you becoming stronger and, oh, you're going to make it. And so that is kind of like a hidden blessing in that.
It is. Yeah. Yeah. I've definitely seen, it's pretty cool. So they go to a Christian school, which they're allowed to pray and have that as part of their education and experience. And so my son, his heart is, it's beautiful. Like he was already this kind of a kid where he just loves people, and makes friends with anybody.
Mhm.
But now he recognizes when people are hurting and he makes a point to stop and pray for them and pray over his friends like he has no shame. And as a middle schooler to pray over your friends, like
Pretty
that's a
amazing.
big deal. He actually prayed over his friends before their track meet in the track setting on the field around all these middle schoolers from public schools. Not that anything's bad about that. I don't want to seem
No.
that way, but like to make that in front of all these strangers that you don't know anybody and you stop and pray over your friends before they compete, like wow, I would have never been that kid. Like I
Yeah,
would have never been that brave. And so to see him just owning it and his faith
that's
through
amazing.
it has gotten really
Yeah.
strong, and he sees himself as a leader. He's been they have a chapel every Friday, and so he's doing like worship where he gets on stage and plays the ukulele and sings. And
This is
so
amazing.
it's like empowered him to really step into it and own it. And so it's pretty cool.
That is cool.
And
There
my
are so
daughter,
many blessings that
yeah,
come out of this. I mean, weird
yeah,
things that you would never have understood how impactful it could be. So this could have really
mhm,
trajected him into this new life path.
yeah,
And what a
yeah,
blessing that is. So,
yeah. And to lean on God at that age and really know what that means, because there
mhm.
was a lot of uncertainty and unknown, and that's really what we had to hang on to was our faith. And so to see me doing it and to see everybody in our family praying and loved ones surrounding us, and like we had a meal train through our church and they would bring us meals, and he would be like, they're bringing all kinds of stuff. And at one point he's like, maybe they should stop. And I was like, well, it's a blessing for them too to do it. Like people love to give. And so he started being, I think initially it just felt like we don't need this. We're okay. He didn't want to feel like we needed that support. And then after a time, he started realizing when they would come in and talk with me, and like it was good all around. And so I think definitely it's changed his perspective on some things.
Yeah.
And I think as an adult, he's going to be pretty fantastic. So
I think that kid knows the power of prayer, and that's
he does.
amazing.
Yeah. Yes, for sure.
That's a beautiful, beautiful outcome for such a traumatic thing to go through. So, but you look like you're feeling good. You look like you're getting your health back. Have you had any sort
Yeah.
of long-term effects of, side effects from all the medicines or anything?
Yeah. The Taxol carbo, I did the icing, the mitts,
Hmm.
but I do still have some minor neuropathy. It's just when I take a very low dose of gabapentin once a day, and it helps it, but whenever it like wears off, I get that heat sensation in my fingertips. Um, and then I have dry mouth,
Hmm.
which I take those little xylitol melts and I just use those like nonstop and lots of fluids.
Yeah.
And then chemo brain. That's probably the biggest struggle is
Yeah.
like that definitely short term memory is a challenge. If somebody tells me their name, which I was never really good with names anyways,
Same.
but it's like
Let's be
worse
real.
now. Yeah, yeah, yeah.
But now it's real bad.
It's not as real. Yeah. I haven't like done any weird stuff where I've left weird things in the fridge or anything like that, but it's a struggle to remember things. So I definitely live by like my calendar and notes. I try to take notes on everything. And so I've
Too.
thankfully where I'm going back to work, it's with peers and friends. And so my boss used to be my peer. And so I've already told her, I'm like, I'm going to need a lot of things in writing. Like if
Mhm.
there's one accommodation, it's just anything you want to tell me. You can tell me in person, but also send it to me in an
Yeah,
email.
same. Because I'm gonna need to reread it.
Yeah, exactly. I will likely not remember it in 30 minutes. So,
Yeah.
yeah.
Yeah, I went to the pool place the other day to get my chemicals right, and he was like rattling off all this information, and I just pulled out my phone and I was like, pause. And I was
Yeah.
like, if I don't write it,
Let
I
me
will
write
not,
that.
in 5 minutes, it's gone.
Yeah, yep. Or let me record you saying this for
Yeah. Well, so anything that you would have done differently through your journey looking back?
No, I did. I didn't really share this, but I did get a second opinion at a cancer center that's in St. Louis. So it was about 2 hours away. I did end up doing my surgery there because I had gotten some inside information on the surgeon at the local hospital. But the medical treatment was going to be the same regardless. And I knew going weekly and the radiation part too, like going daily, I wanted to be close to home for those, but the surgeries I did have in St. Louis, and I'm glad that I did. My outcomes were great. Not to say they wouldn't have been good there. I just, sometimes you have this sense of knowing that something's better than the other. I think from given my stage and the amount of cancer that I had, I think the conventional was the path for me. I did integrate some like extra, I guess, therapies. I did some acupuncture through my chemo, which
Hmm.
helped with the neuropathy and the
Yeah.
nausea. Did some massage, lymphatic massage. I did physical therapy early on, which I always tell people like it's not always thought about, but even during just chemo phase,
Yeah.
because you're getting so fatigued and the chemo brain, I worked with an occupational therapist. Those were really helpful. And then I already was established with them, so they knew my pre-surgery, like range of motion. And then post-surgery, we knew like this is the goal to get back to.
Hmm.
I've done that actually all the way up till yesterday was my very last physical therapy
Oh,
appointment.
you graduated.
Like, oh, I'm gonna miss them. They're so great because really what they do at this point is more like massage, and they do red light therapy and some like suction
Mm.
just to get into that scar tissue. And then I have a little bit of that cording. And so she really gets into the tissues. So I don't know what I'm going to do without her.
Yeah.
My husband's like, can you teach me? I'm like, I'll try.
It's not the same though.
I know, I know. And
That's
she's
really good
retiring.
advice. Yeah.
Yeah, yeah, she's retiring. So it's like, it's kind of good timing, but I will miss them. But yeah, I definitely recommend finding somebody who breast physical therapy is their thing. Because some places you'll just get whoever is
Right.
on staff, and it that consistency is really helpful. If you can find somebody that will do that, so
Yeah.
highly recommend.
And always, always advocate for yourself because they'll forget to put you in physical therapy. From what I'm hearing, that you have to kind of ask because it's not always the norm. That's just automatic written. Oh, you've had a double mastectomy. Oh, you're going to have all this scar tissue. I met a lady who lives here locally that had so much scar tissue that she can barely use her on that side. So she's almost now disabled from limited motion. And then when she had gone back, they were like, why weren't you in physical therapy? And kind of blamed her. And so it was just kind of a horrific story.
Yeah,
I'm happy that you touched on that because I think, it's a major surgery. Even just taking the flaps from the tummy is a major surgery. Like there's scar tissue, there's, with the radiation, the skin kind of thickens and everything kind of gets tight. So I think it's just so wise to do the acupuncture and all the, breaking up. And I've done a couple of videos on here about the importance of lymphatic drainage and lymphedema. I had a lady kind of show her technique on me and why it's so important. So it's just, these are things that maybe your medical team's not going to, advocate for you. So you have to
yeah,
kind of know how
ask
important it
for
is.
it.
So it's really
Yeah,
cool that you're a nurse and you're, saying that you went and sought all this other treatment too. And red light
yeah,
therapy, people don't really know
yeah,
about that.
yeah, yep.
So it's
I
really,
did.
go ahead.
So she does that with the physical therapy part. Also, too, it was good to see before surgery for them to do measurements. So they watch for lymphedema because it can be so minor when it starts, my understanding, that if you don't have those pre-surgical measurements, sometimes you're not really going to see it until, unfortunately, it's further. And once it progresses, you can't really go back on lymphedema. So if anything, at least get an appointment, just even if it's just one appointment before surgery to get those measurements done. I think that alone would be really helpful.
Yeah.
But yeah, so she does the red light therapy. I also implemented saunas because I knew my body was, we have toxins, we're exposed to so many different things that just in general. Plus, now I've had chemo, which, it does its job, but it's also hard on the body in other ways. And so I knew I needed to flush out things after treatment. Once I was nourished, my levels were back to normal and I could tolerate a sauna. I would not recommend saunas while you're like depleted. That's not going to help you. That's just going to make you even more dehydrated and feeling even worse. So this is more my recovery phase. I've implemented that and then done some like supplements and things, but I don't want to recommend anything because it
Nope.
is very personalized.
Very different for
And
everyone.
yeah,
Yeah.
I think lab testing is important to see where you're at currently and then working with somebody who's got that experience that
I agree.
knows how to work through stuff. So
One thing I did to like rehydrate that helped with my dry mouth was we have a local infusion, a vitamin infusion place, like hydration. And I did that a couple times and it helped me tremendously. And I think my GI was so messed up that I wasn't really absorbing the water or the nutrients. And so that kind of helped me. But you would still have to be very careful knowing what was in the IV to know that it doesn't counter affect your medications or anything that you're taking. But there's so many things out there now. There's so many helpful ways to kind of detox and heal. So you've touched on something near and dear to my heart.
Yeah. Well,
Well,
that's
anything
true.
else that you would want to share? Go ahead.
No, I was just going to share that the advocacy piece too is like, I think it's important for people to recognize that there are parts of this journey that you can really take ownership of, and whether it be self care and relax and meditation or mindfulness, nutrition, like take the pieces that you can take control. Now, don't get overwhelmed with it to where it's like bogging you down, but know that there are pieces that you have the control over and you can make your body healthier too. That will give you that sense of empowerment and will help you feel like you're part of the healing journey. So I think that's really impactful.
And keep moving because I think there's a lot of times where you just want to like not, you just want to rest all the time. But I think moving is so important and it kind of gives you a little control over how your body is reacting. So keep
Yeah.
moving.
Yes. Yeah. Even if it's just a small little walk around the house,
Yeah.
subtle, like set an alarm every 15 minutes and walk around your house. I did get a little walking pad thing because in the winter it was pretty cold. So I was like, if I'm going to watch TV, at least I'll be walking.
Yeah. That's very
Just
smart.
little things like that. Now I was going to share. So as I'm getting back to work, I'm excited. I'll be nursing, but also education. And then I'm in the process. I'm currently writing a book on self advocacy specifically,
Oh, okay.
empowering women with breast cancer. So far, the title is Empowering Women with Breast Cancer Path to Self Advocacy. And so it's in development and I'm pretty excited about it.
That's so fantastic.
Yeah, it's got a little bit of memoir where I'm telling my story, but it also has a lot of education and tools and strategies to help you listen to your own intuition and to know how to ask those questions and ask them in a way that your care team's going to be receptive to it, and knowing that you're a collaborative effort at making decisions for your treatment plans.
Yeah.
Pretty excited.
Well, with your background of education and all the things that you've done, I imagine that book is going to be phenomenal.
Yeah, thank you. I'm excited. It's been fun and it's been therapeutic too to write things out just to like get it on papers.
Yeah, absolutely. And it's
For
going to be
those who
so
like to
helpful.
journal, kind of like journaling in a way.
What is the projected timeline on the book coming out?
My goal is to have the manuscript done by the end of this year, so 2025. And then I've never written a book before, so I truly don't know publishing and editing and how long all of that will take. I would love to have it out in March since I was triple negative, and triple negative day is March 3rd. Because I think that would be really cool to launch it on triple negative breast cancer awareness day.
Yeah.
So that's my goal currently.
That's a good goal.
We're making it so far. I'm on track. So
That's awesome.
well, yeah.
Well, I will put a link, or I'll put the name of the book below. And then if you have any social media pages that you're going to set up for the book or anything like
Yeah.
that, you can send it to me.
Yeah, I have one that I just started, like, I developed it. I was going through treatments because I thought, there's a lot of good information that I could share with people. So it's called Radiant Transformation. It's on an Instagram page. But then I also started a Substack where I've got just short writing forms that I'm putting out weekly. So far, it's just been on like tips and tricks and things of that nature. But I am going to start kind of highlighting my writing process.
Mm-hmm.
So you'll get little sneak peeks of the book as I'm writing it, so that you can kind of see what the book will be about as it's developing.
That's really cool.
Yeah.
That's a very good idea. And also very good to help people as you're going through it, to kind of give you helpful tips and tricks. And education is my favorite thing ever. As a dental hygienist, I love to educate my patients and like over educate, really. I probably tell them way more than they want to know, but it's so important. So education for me was like key. So it gives me hope that you're going to be writing on something that's so very important, because I felt like that was a huge missing piece in my journey. I didn't get the education that I sought, and I didn't get the answers that I wanted, and I turned to the internet, and but that's okay, because that is how this channel was birthed.
Oh,
And I had turned to the internet about, my chemo was known to cause neuropathy. And so I was like, oh, what can I do to prevent that? So I found out about the gloves and the socks. And of course I did that, the icing. And then a lady in a parking lot had just left her holistic oncologist, and she was like, he said you could take L-glutamine to help prevent. And so I did all this like research on that, and I was like, but it was so helpful just to even have that like tip. So then I was like, okay, so how can I be part of the solution? And so, and giving power. So I love that your book is empowering, because that's the whole heartbeat behind the channel. I just want to let you know that all of this is empowering, and you have power over all of it, and power over
knowledge is power, right?
It truly, truly is. So, well, best of luck on your writing journey, and best of luck going back to work and getting back in the swing of things of life, and continuing to heal along your journey.
Yep. Living life.
Yeah.
Excited to be here. Excited to every day I get.
Every day is
a
a
blessing.
Gift.
Yes. For
and
sure.
every day or every year we get a birthday. I mean, when you touched on that, so happy almost 40th.
Early. Yep.
And
I'm excited.
I'm definitely beyond that. I'll be 46 this year, and proud of it. And some people are like, "Oh, I don't want to talk about how old I am." I'm like, "It's a gift. I will shout it from the mountaintops. I'm 46."
Take it. Exactly. Yeah, this is kind of a big deal to get to the 46.
It is a big deal. So life is worth celebrating, and
for sure,
education is the key to everything. So, well, it's been a pleasure of mine to get to meet you and know you, and to tell your story on the channel. So thank you for taking this time.
Thank you for having me. It's been an honor.
Well, if any of you guys watching have any questions for Natasha, or want to get in touch with her about her book release or anything like that, just let me know in the comments, and we can connect you guys. So thanks so much for watching. Stay tuned for more warrior stories, and we'll talk soon. Take care.
Thanks.